Afternoon to one and all present here, in person and online. We, the Dr. M.V.L.K. Chair and Division of Medical Humanities, are extremely pleased to have you here with us today.
I'd like to start off today's ceremony with the lamp lighting ceremony and the prayer.
Start. So, we'd now like to welcome on the dais our dignitaries and present them with a floral bouquet. First, we'd like to invite respected Shenri ma'am to give our respected Dean Dr. Sangeeta Rawat her bouquet.
We'd like to call upon Dr. Nadkar sir to please present a token of our appreciation in the form of a floral bouquet to Dr. Supe sir.
We now invite Ms. Dr. Mehta ma'am to give the bouquet to our respected Dean, Dr. Sangeeta Rawat, now that we have given Pandya sir already.
We'd also like to call upon Dr. Padmaja ma'am to present a floral bouquet to Lopa ma'am.
We now call upon Dr. Salagri sir to give token of appreciation to Dr. Ravi Ramakandan.
We'd like to call upon Sandhya Kamath ma'am to please give a floral bouquet to Dr. Urmila Thatte ma'am.
We now invite Dr. Shenri ma'am to give a token of appreciation to Dr. Shri Sagar ma'am.
We'd like to request Swarita ma'am to please give a floral bouquet to Dr.M.V.L.Kothari ma'am.
We now like to pay our respects to Dr. M.V.L.K. Kothari on this occasion by reflecting on his legacy. What do you want to talk about? So, we get to find that the word doctor comes from lead is this, lead the ship, and the one showing the path. So, lead the ship becomes lead becomes doctor. And the word doctor, that's first thing. We never find it. The word was, that's what I saw on. Server, serviceman, management, restaurant, works, everybody, the person was the one. Very professional works, like the color, they are I was very strong fellow. I don't know how you don't know that talk like that. It's professional session. It's confronting why should I like my person? Why should I like my person? No, you know, chance passion. See, hey, that's it. I'm going to say, let's be the ones who are not person. And I'm not going to be, I'm not, like, 50 months, that's, we have look, let's put up our own person. I'm not going to pick up, ready, no, was not the solution I should say of it. Explain my sense and all about the right action without the plan. About yeah, from small out the last problem. Like a 16 surgery, we got a great comfort. I was watching this was the time. Just don't go away to try. Well, this is my heart. The feedback in the so, the passing, that's not the line. Leaves abortion. Leaves skills, clear, happy, able, listening, leaves done, more subject. Stories, simply, and not so that's so we see a passion of love and the girl kind of how God slowly. So it was supposed to be really rare. When I not now, the kid it will make a more than I make a kid it will make a
Sorry. Dr. M.V.L.Kothari, Chair in the Division of Medical Humanities, was established in the memory of this great man. Among students and faculty closer to the humanities and those to enrich their lives. Dr. Avinash has been kind enough to share with us these slides from when the division was first established back in 2016.
The division has gone on to host multiple workshops on topics like gender, the history of medicine, as well as Ascension, the annual Medical Humanities Festival. All of this has been possible due in no small part to the support given to us by the Honorable Dean, Dr. Sangeeta Rawat ma'am. Thank you, ma'am. I would now like to invite Dean ma'am to say a few words on this occasion.
Respected Dr. Pandya, Dr. Supe, Ravi, Dr. Lokamata, and Dr. Shirsagar, and all others senior members in the hall. I think when we listen to Sir's video, I think I still remember nostalgic about my first day in this hall itself, and Dr. Kothari had given a talk. So I think we know how effective and how it is to make impressions in our lives and the best life. And we is very mesmerized by his talks. And I think it is good we got it to by starting this MBA chair, Kothari Chair of Medical Humanities. And while going this medical profession, the corporate hospitals and all, the corruptions will increase in every field. Somewhere we used to forget this medical humanities. And I think it was very important that we rejuvenate this medical humanities in right from the first immigrants in the student's mind and till the all the faculties that we first for us, the patients are first, the money is second. Vivekananda says, serve Jiva as Shiva. So for us, the patients are our God. And if we have to keep those flames inside our heart and inside our conscience, and for that, I think this medical humanity branch is very, very important. I think Dr. Pandya, I mean, I know him when I joined my medical, my DL neurology, and we always knew that he is someone so astute in his surgery, so astute in his clinical skills, that we used to really, look upon him for every word what he teaches, or every time we so scared to meet him, but whenever we met, We're always sick. Speeches will be very important for us to know in our neurology and neurosurgery. And we all know we had carried forward the neurosurgery department was wonderful. And I think Dr. Supe, everyone knows. And I think when I took over as a dean, I had spoken to him, please give me some advices and tips so that I can become as good a dean as you were. And I think all of us know that if we would be so kind and listen to everyone's problem and try and solve as many as possible. And I'm also trying to follow the same to some extent. I hope I can do that. So I think when we talk about this medical humanities, the very important thing is that we need to teach this humanities not only to doctors, but also to our nursing staff, also to our class 4 employees. That's what I had told Padmaja and all when I took over as a deanship, because they deal with patients much more than we deal also. So I think for us, this medical humanity doesn't stop only with doctors, but it's also that we teach this values and this ethics to others also, and to the nursing staff as well as to our ward boys and IR because they are the ones who are in close contact with patients and their relatives. Doctor spends 5 minutes, 10 minutes, not more than that. So I think that's what I still request to have this, have these classes for them also. And I think from I was told we have a space for medical humanities department and we planning to something like 1,000. We will need to allocate some space definitely for this. Not as much as you asked for, but but definitely I try to have that. And I think whatever I think the students also become involved in that. That's also very important that they are doing those activities right from beginning to know what medical humanities are and what values we want to teach them. And I think Dr. Sunil definitely do great justice to this chair after he takes over because he himself is an epitome of medical humanities and ethics. So I wish you all the best, Dr. Supe, and I thank Dr. Pandya for doing this for so many years and doing it so well. And I think we've done lots of things in this under this chair. Thank you, sir.
Thank you very much, ma'am. I'd now like to call upon Swarupa ma'am to say a few words about the division.
Yeah, good afternoon. It is indeed my honor to talk about Dr. Kothari sir and the chair that has been established after him. Dr. M.V.L.Kothari, former professor and head, Department of Anatomy at this institute, had been a learned scholar, noted academician, one of the most loved and respected teachers, a medical philosopher, and an author of many papers and books on topics like cancer, death, environment, and medical philosophy. He was associated with the institution from the day he joined as a student and his passing away at the age of 79 on 16th October 2014. In the remembrance event held in respect of Dr. Kothari on 18th October 2014, teachers and others touched by him expressed a desire and an urge to establish a chair of medical humanities in his name at St. J.S. Medical College and KM Hospital. His objective was to help bring about positive transformation in current medical scenario, which instilling and fostering a humane and ethical approach practice of medical science. The then Dean, Avinash Supe sir, enthusiastically supported this idea. As you could see on the slide, the chair was officially established on 23rd January 2016 our institute under the aegis of the Sumek Arna Association. The renowned physician, Dr. Farooq occasion was the chief guest. He discussed history of medicine as the foundation of cultivating medical humanities. Dr. Sunil Pandya sir took over as the first chairperson that time. Pandya chair of Medical Humanities aims at inculcating in undergraduate and postgraduate students humanity, ethics, love for philosophy and the art, and thus helping them treat patients with empathy and kindness. Since then, the work of the chair and the division is being looked after by the core committee, Padmaja Saman Madam being the coordinator. The student secretaries every year they work enthusiastically under the guidance of core committee members. Dr. Lata Mehta Madam and Dr. Ravi Makantan Sir are the advisors. Their and Dr. Pandya Sir's guidance has encouraged the committee members to work more and more towards the goal. A series of lectures, screening of films and documentaries, skills and creative care workshops were conducted in 2016, that is the year of establishment. Photography, writing and filmmaking competitions were also organized for students. Since then, there was no looking back. The chair and the division has been organizing lectures, lecture series, workshops, orientation programs, interactive sessions, interviews of former teachers, reviews, and whatnot. History of medicine, philosophy, interpersonal relationships, ethics, and art. All facets of medical humanities have been included through these various programs. Recently, history of medicine, tribal health, narrative appreciation and reflective writing, gender and health were organized as short online certificate courses for students and faculty. The plan of establishing a year-long basic course in medical humanities is also underway. As we look forward to the centenary celebration of our institute, the Humanities Chair and Division has been organizing virtual reunions of present and former undergraduates batches in collaboration with the SUMEC Alumni Association. The foundation day of the division is celebrated every year on 23rd January. Manasmriti event is organized on 16th October in respect of Dr. Kothari sir on his birth anniversary. Ascension, a step above, is the annual conference of the chair and the division, organized every year by students from other institute and other medical colleges actively participate. A new theme is chosen every year for the conference. Reflections is our annual publication. Until now, 4 issues have been published based on different aspects of medical humanities. Our recent collaboration with the SUMEC Foundation will help us tremendously in enriching the activities of our chair and division. With strong support and encouragement from our Dean Madam, Dr. Sangeeta Rawat, we have been conducting our activities smoothly and successfully. We also envisage the transformation of the Division of Medical Humanities into Department of Medical Humanities in the near future, enabling the enhancement of our work in the areas of medical education and patient care. We will surely achieve it with the guidance from Dean Madam and Dr. Supe sir. Thank you very much.
Thank you very much. We would like to now take this opportunity to introduce one of our guests for today, Dr. Sunil K. Pandya. Dr. Pandya is a renowned neurosurgeon who headed our own department of neurosurgery for more than 20 years and took it to even greater heights. And after his retirement, continued to work at Jaslok Hospital. He's the father of medical ethics in India. What he had initiated is now flowered into an international journal, the Indian Journal of Medical Ethics.
Dr. Pandya is a renowned scholar of medical history. Medical students admitted in this college from 1985 to 2005 will remember his amazing lectures in the history of anatomy. He has contributed a lot to the history of not just KM Hospital and St. GS Medical College, but also Grant Medical College, and is actively working on a history of ours as well. He has been chair of the Dr.M.V.L.K. Chair and Division of Medical Humanities since its inception. He has given us both vision and direction. We thank you, sir.
I would like to request our respected Dean Ma'am to kindly present Dr. Pandya with this scroll. Yes, sir. The scroll reads, This current honor is being presented to the first M.V.L.Kothari chair, Dr. Sunil Pandya, for his contribution to the development of the medical humanities division of St. James Medical College and KEM Hospital from 2016 to 2023. So, we have been privileged to have you with your clear vision of goals that help us study the seldom appreciated nature nuances of human medical care. Your knowledge of history of medicine and bioethics added new dimensions to the activity of this division. Your sagacity and experience help us carve a more field of medical humanities. We are truly grateful to you for these teachings and will cherish them as our guiding principles, even as we pass on the baton to Dr. Avinash Supe. Thank you.
I would now like to invite Dr. Pandya to say a few words on this occasion. Sir, will get you a mic. Sunil, sir.
This journey from the formation of our division of humanities up to today has been exciting and rewarding. There were doubts when the division was first suggested, and the suggestion that we bring alive the hopes and aspirations of Manibai. I used to call Dr. Kothari as Manibai, so please pardon me. I had often expressed that one factor which is missing in the curriculum of the medical students of India is the attention to be paid to the humanities. The word humanities is a very, very broad term, and it encompasses many topics. It encompasses humanity itself, the manner in which we belong with each other, with patients, with those who are superior to us, with those who are junior to us. It also encompasses the principles of ethics. It encompasses the history of medicine, a very rewarding subject to study, and a subject from which we can learn a lot. And we continue to learn more and more as we study the works of our predecessors, not only in this institution, but also in other institutions in India and abroad. It encompasses the very enriching world of literature, music, art, drama. In literature, we would include poetry, which is sadly missing from the interests of many medical students and doctors. So it's a huge topic, but something which is very rewarding and very enriching for ourselves. And therefore, what Baba used to say that this is missing in the curriculum was very true. In the hustle and bustle of getting into medical college, trying to get 100% marks so that you can get the medical college of your choice, we tend to study not to learn, but to be able to score. We tend to enrich our memories at the expense of understanding. And so when we come to medical college as students, we are conditioned to work towards scoring a large number of marks. And anything which distracts from this goal is to be avoided like the plague. And so the humanities naturally get pushed aside. And this, I think, Manubhai felt very strongly. Fortunately for us, when he passed away, and he passed away very suddenly, he was sitting in his home talking to his family members, and he suddenly collapsed. And before his son, who is an intensive care expert at one of our suburban hospitals, could do anything, Manubhai had gone. And the family felt that something should be done to perpetuate his memory in the institutions which he loved so much, the St. G.S. Medical College and the KM Hospital. And so they consulted Dr. Lopa Mehta and Dr. Ashok Vaidya, two people who were very close to Manubhai. And based on the advice of Dr. Ashok Vaidya and of Lopa, the family decided that we would like to sponsor a division of humanities in his institution. And they were prepared to fund the activities of this division. And that is how this division came into being. As it happened, the dean at that time, the dean of GS Medical College and KM, was an especially far-sighted individual, an eminent educationist in his own right. And he saw the vision behind the creation of this division. That gentleman is sitting on my left side, Dr. Supe. And he very readily agreed to this proposal. He agreed to have installation meeting. And if I'm not mistaken, we had eminences like Dr. Farooq, who was present at that particular first meeting that was held in its very auditorium, which is named after Dr. Jivraj Mehta now, our first and founder dean. And it is in this hall that this division of humanities came into being. Very kind words have been spoken by our dean, Dr. Sangeeta Rawat, and by the speakers at the podium about what I have done. I must correct this misapprehension. I've done very little. The heart and soul of the division of humanities has been Lopa. If credit must be apportioned to one person, and it would not be correct to apportion it to one person because the achievements are the achievements of a group. But if credit has to be apportioned to one person, that person has to be Lopa. Fortunately for Lopa and for me, we had help from few others, and I will only name three of them. One is Dr. Ravi Ramakantan. He retired as professor and head of the department of the imaging division. It used to be called the radiology department, but I think that term radiology is now supplemented by imaging. So he was professor and head, and he retired from that position. He succeeded another lady who is sitting right in front of us here, who also is an ardent, what should I say, disciple of US Medical College and Canadian Hospital, who in her own right has done a lot for not only her department but also for the institutions. So tribute must be paid to Dr. M.V.L.Kothari also. And I think Ravi would be the first person to agree that she deserves a lot more credit than has been given to her so far. So anyhow, Ravi was one of the persons on whom Rupa and I have leaned on very heavily. The other two persons have been Padmaja and Swarupa. So if credit has to be given for these achievements, it has to be given to Rupa, Ravi, Padmaja, and Swarupa. These are the people who have achieved what the division has achieved so far. And I am very happy with what has been achieved. I mean, quite apart from what Swarupa has spoken about, we have had the benefit of getting into this particular auditorium individuals like Dr. Karu Kudwadia, the late Dr. Bhiv Patel, who was a poet, dramatist, general practitioner, who is unfortunately no more. We have had Dr. Himmat Bavaskar over here. We've had many people who have worked in the rural areas and who have done so much for the neglected poor in the villages and small towns. They have all come, whenever they have been invited, they have all come here without hesitation, willingly and voluntarily, and have spoken to us and to our youngsters in this auditorium. The auditorium is always full when individuals of this caliber come and address us. And I'm sure our students and residents have learned a lot from them. Another item which I would like to lay at Rupa's board, to her credit, is the formation and maintenance of what is called Janus. The word Janus was derived from a Roman god. And this Roman god had two faces, one face looking forwards, one face looking backwards. This symbolism is that the more we look backwards, the better we can perform forwards. And therefore, history is extremely important. The word January is derived from Janus. January is the first month of the year. It looks back at December, November, October, and it looks forwards at February, March, and so on. And this museum, which this college possesses, which is unique to the city of Bombay, certainly. Hardly any institution, not only in Bombay, Maharashtra, but even in India, I think there's hardly any institution, except perhaps St. Barnes in Bangalore, which has a museum of this kind. So Janus also has to be laid at Rupa's door to her credit. I can go on about the many, many things which Rupa has done. She has recruited colleagues, she has recruited residents, she has recruited students, she has got the secretaries of the GS Medical College Students Association. She has recruited individuals who have gone out and interviewed senior members of the staff who had retired, some of whom have passed away. We are lucky that their thoughts, their ideas, their experiences are available to us as video records, and they're permanent records. We will have them forever. So all this is the foresight of Rupa. I think if I continue along the list which I have made, we'll probably go on till tonight, so I'm going to cut that short and refer to a new development which has occurred over the past few months. And that is the collaboration with Dr. Sanjay Bindra and the Bosunians in America. Dr. Sanjay Vidya and the Gossymex in America have set up the Gossymex Foundation. And they are doing superb work, not only to perpetuate the history of their alma mater in America, but also to fund developments and improvements in GS Medical College and KEM Hospital today. And our dean might like to say something about their contribution in this regard a little bit later. Before I close, I'm going to once again refer to Dr. Supe and to another lady who is sitting in the front row over here, who is fondly known as GS. I apologize for this coughing. GS has made many contributions to this two institutions of ours, but an outstanding contribution was a documentary film, which is a feature film, full length, on the functioning of the GS Medical College and KEM Hospital. And to her credit, she has not dwelt only on the favorable aspects. She has also shown reality in the form of warts. And I think this documentary film will probably be the definitive documentary film on these institutions for a long, long, long time. I cannot see a better film being made in the near future, at least. Finally, Dr. Supe. Dr. Supe won't remember this, but he helped, how shall I put it? He helped save the life of my wife. You don't remember this? She developed acute appendicitis while we were living in the assistant building, Pandya. And in the afternoon, the pain was there, but not striking. It could have been something else also. By about 8 o'clock at night, it was obvious that this was acute appendicitis. There were local tenderness, rebound tenderness, the works. So I requested Dr. Supe to come and see her. And he came promptly, examined her. And he agreed that yes, this is acute appendicitis and it needs urgent surgery. He was at that time the registrar to Dr. Avinash Supe, who was one of our professors of surgery at that time. And he and Dr. Supe came over, I think at about 11 o'clock at night, and did the operation, removed the appendix, which was really swollen and turgid. It looked like a big fat roundworm. And looked after my wife till she recovered fully. So I have another reason to be thankful to you. Finally, I cannot think of a better person to head this division of humanities than Dr. Supe. In closing, I'm going to reinforce two suggestions which our dean has already made. One is a request that we get a full-fledged Department of Medical Humanities, full-fledged, committing professor, assistant professor, whatever, premises, a small lecture seminar room, a museum, a library, everything within that department. And that is going to take time. But till that matures, I'm going to request her, because some time ago, there was an urgent need for what was the office of the Division of Humanities, so that room had to be given back to the college. The room had been allotted to us by Dr. Supe. They have to be given back. If that room is now not urgently required, could we please have that room as the office of addition of you? For the time being, once you have a full-fledged department, then of course we may not need that room. So this is a request. I think I've already taken up too much of your time. Thank you very much.
Thank you very much, sir. I'd now like to call upon Dr. Santosh Salagare, sir, to introduce Dr. Supe.
Yeah. I'll start. Let's keep on the servers of this. You have to have more. Okay. Not much. My host. It's almost bumping. However, Dr. Avinash Supe, sir. And before beginning the formal introduction of sir, we express my sincere gratitude to my sir for the status has given us power of medical abilities or respecting them. On right, and so that's was the deadline in the sir. Things, so that's I actually running yesterday on, but I'm supposed to speak very practice what I have not been. A lot, but the relevance to other systems spoken about side, which will be not specific. This one not going to know this business life at all. Basically, for the masters for second answer, I was already harassment for about party. This particular aspect is very important. That's why I written of the aspects. My first series was qualifications in the field of surgery, biosurgery, the administration, and professional agriculture. Whether you are at choosing a graduate benefit, this next example is at least one of students which are miraculous with management or understood practices. Says, child what has been replaced by this technique prostitutions. Most of us presently remembers such similar as being by the part of our English policy and most of the possibility is unknown. For much of the fact, it's no source of success, newspapers, and professional educators. Service applied card, very comfort of and education, graphically. If it's for serve responsibility of giving children medical education and master of competency-based medical education with a competent master tool. It's created modules are the time on aptitude, text and communication skills. It's very important properly. Because between the flavor of communities to medical education in our country. So this recipient prestigious Bussar Award and more than 55 awards. So giving away towards scholarship and laboratory skills on wide variety of scientific deliberations, so advances and innovations in commercial education. His journey has lived itself to reflect humanities. More than 126 scholars has devoted his work in society. His photography skills are outstanding and provides the opportunity to witness the nature's plan and messages out of these particular shows rather than specific shows members. Now, जो बड़ा अपना प्रॉब्लम है समाजाला समजून आणि वाचून अशा प्रकारे मातृभाषेत ज्ञानाचं सरांचं प्रसार आपल्याला त्यांच्या बदलची वाटून ऐकताना होते. महत्वाचं आहे वाचणं महत्वाचं ज्ञान त्यानुसार असे साचना देतात. However, there is not this purpose, 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 it will follow capturing cameras or savages. Architecture
As well as such a destination, what how that calculable visitor was professor. So, there are two main waters. The medical education department headed by our dean madam. Now, center and the former process that is going on, and madam has overseen the courses and she has witnessed the work. And she probably but you was just compromise. Our mental educators is all because of self mentorship. The self you have to make fellowship. So that is what when the Bhaja Madam, Ms. Farita, and all sitting here, sir, you have mentored us, and now you are going to mentor the entire institution through this medical humanities chair. This is what I wanted to say about sir. Thank you so much.
We now request Dr. Sunil Pandya to hand over the plaque to Dr. Avinash Supe, sir. Supe, sir, we now request you to say a few words. Yes, sir.
Close this. Respected Dr. Pandya, Dr. Rawat, Dr. Lopa Madam, Dr. Ravi, Urmila, all the dignitaries, Dr. Kshisagar Madam, all HODs and friends. Thank you, Santosh, for such a generous introduction. Actually, I told you to say only 2 words, but you said you would like to really give that. I mean, coming to this hall is a different vibes. You know, my whole life has gone in this hall, and I always feel something which is always good. I think I'm really honored and humbled to be becoming this chair of medical humanities. I think when I had been sometime in 2015, I think there was a meeting and the idea came that medical humanities chair we should have. I think there were so many options, like we could have started an oration, we could have started a scholarship, or we could have started some different thing. But I think knowing Dr.M.V.L. Kothari, Manubhai, I mean, sir, and talking to him every day at lunch and day-to-day discussions, I think this was the best kind of a tribute or remembrance of we could have really done. What he used to really tell us every day, if you are able to bring it to our college and our students, I think there's nothing like it. So I think creating a division of medical humanities, actually we wanted to do a department, but you know how the things work in corporation. So we got an official sanction for developing division of humanities. It's an official document signed by MC and MC. So it's something which is very officially we tried to bring it. And I think what is more important is the way Dr. Pandya really gave a foundation to this department. It's the man behind the whole idea who gave that foundation, and I'm sure the whole group really took it proof well. So many orations, so many personalities coming, workshops coming in, and it gave a different kind of a stature to this department. By this time, there are many departments in the country, they started developing humanities, and we were one of the leaders into the whole that department, which I thought we actually started. Maybe we did it about 10 years before. We could have started somewhere in 2010 when Sir was there. But I think we started at little late, but we started it. And we are now one of the top. What Dr. Pandya brought the wisdom, I personally feel. So I would like to really thank Dr. Pandya for doing this particular thing for our institution and alma mater. We are giving him farewell. I don't like the word farewell. I think, sir, you are going to stay with us. You are going to be part of us and you're going to do that. I must tell you, this thing that I love about Sir is that his wisdom mail, I call it. You know, I call it as a wisdom mail. Every day I get a mail from him and there's an article or a thought or something he says. It cheers my mind. It makes me much more brighter, wider in my thinking. I think, sir, continue to do that. I would like to say, don't stop, sir. I think you have to do this for us And I think if you are all not reading that mail, I think you're missing something. I think it's a time we should send all his mails to the every person. It should be some kind of a board where you should read that article and should see what he really brings onto the table. So thank you very much, sir, for bringing that. And we would like you to really continue that. And all our gratitude to you for bringing this level of medical attitude. The second thing I wanted to really thank is Dr. Ravi Ramakant. You know, I was actually deep into medical education by 2010 or 11. But one day he came to me and told me that, will you write an article for medical humanities in medical education? And I tell you, I was a blank at that time. I was not knowing. He brought, I think Ravi came and told me, you write an article. So I was blank about medical humanities. You know, we listen to Dr. Kothari, is all principles of humanities, but that word medical humanities doesn't trigger us. We feel it is something different. So I put it to our international and national network across the world. You know, I put this to medical education, and there were diverse views. There are people who reform medical humanities. There are people who say it doesn't work. And, you know, there's a controversy in the medical education literature is still high. So, anyway, I wrote a wonderful article. It got published. And when I got this opportunity, I personally think that this is something where we could really develop. And today, after say 15 years, I find it very relevant. And why so relevant? I must tell you this. In the new curriculum, you know, we had done in CBM in 2019, we had put 5 roles for a competency-based graduate, you know, a clinician, leader, and all everything. In last 2 years, the MMC put 2 more roles. One was a researcher, and other was a critical thinker. Now, where do you bring in this critical thinking and creativity? It doesn't come so easily in the minds of our students. So, if you really go through the whole creativity, innovations, and critical thinking on one side, and careful, I mean, how you care for people, responsiveness, values on the other side, how do you bring in our students? Now, if you really look at AI, I recently read a very nice article, sir, about AI. And it's what will happen to the physicians after AI? And it gave a wonderful kind of a paradigm. One paradigm it gave was repetitiveness versus creativity. Another paradigm was data-based versus interaction-based. Very nice 4 parameters. And it said those activities which are going to be repetitive-based versus those and data-based, they are going to get grossly impacted by the AI. And therefore, a radiologist today needs to learn AI. He will do his repetitive work like routine X-ray, but then he'll have to put in effort into creative work. The specialties which are the interactions with human interaction, which is there, they are going to get less impacted, like neurology, psychiatry. They are not going to get impacted by AI because there's an interaction based with these patients. So now, if you really see, over a period of time in next 25 years, the repetitiveness activities and creative, I mean, and the data-based activities because of data crunching will be taken over by AI. So as a physician, we need to concentrate on our creativity and interaction base. So how do you build that creativity and interaction based into our medical students? And there is no formal curriculum for this. This formal curriculum has to be an informal curriculum through medical humanities, where we implant the seeds in our students, make them better, make have a wider perspective. And that is, therefore, I think the value of this medical humanities is much more than what you really think. Maybe when many students will learn it through cultural department or debatory or something. It has to be now one formal and informal kind of a curriculum. You know, I realized this last year. We established the whole UG curriculum of Bhutan, and we did it. And at that time, when we were talking with the stakeholders, including the Prime Minister and the Health Secretary, all of them told me that we want a segment of humanities, a strong segment in our curriculum. So we created a booklet of humanities for the UG curriculum, and it is implemented. Last year, WHO, madam, developed a global network of humanities. There was a whole conference on medical humanities by WHO in Sri Lanka. So I'm trying to tell you this is something, and if you really see the network, the activities of those networks, we will amazed to see how humanities have been helping students to bring in all these kinds of activities. And we should really not underestimate the value of humanities. It should be informal curriculum. Students who are lost into next and neat, I think we need to tell them that yes, interaction based and creativities are part of our life, which should be lifelong, because that is what is needed in your career. Thank you, Lata Madam. And the whole team, I can't really thank her more because she is like, I mean, the way she built up the whole kind of these medical humanities and taken up the kind of sincerity, or I think perseverance, the way she built up the whole team. And I'm sure Padmaja, Swarupa, Santosh, and I'm sure everybody has contributed immensely into this particular building of this unit. I personally, whatever was possible, I have enjoyed these programs, online or offline. Whether it's history, whether it's Janus, whether it's literary, poetry. Today you can create a poem on Chat GPT on KEN within a minute. It's not very difficult to do it. We Chat GPT literally just, we really don't know. We need to think about it. And that's where you need a human being and humanities. I think we cannot say that just because AI has come, I'm going to lose that. No. In fact, now I have to concentrate more on creativity. And I think that's what probably we need to build those seeds. Thank you, Dr. Rawat, and our whole the team of academic thing. Thank you, Sangeeta, for really helping this. And of course, because I think without your support, this humanities importance will not go to our students. And Urmila, of course, is the big support for all of them. I must not forget, there are so many people who have helped this. I mean, Suhas is there, Rama is there, our students are there. They are the greater people's strength. And seniors, like I think I'm sure Chisagar Madam, Dr. Sir, Malin Madam, all of you, Vaidya Sir, I think all of them have really helped to grow this humanities into something which is now at this stage. And we have to go up. We have to not only maintain this, but we have to add many things onto this. Lastly, I'm telling about my own students. I think I understand we are all busy. I also very studious student, spent many years in all this on the first bencher, writing notes. But unless you move out into various aspects of life, you will not get that wide perspective and a deeper thinking. We can have always created great physicians. And what did Osler say? Osler said, good physicians treat the disease. Great physicians treat the patients who have a disease. So I think we have to really look at patient as a whole. And I think unless we create that mind and we start looking at it, we will never be able to really achieve this. So the whole purpose of this humanities, don't consider is only some activity which we are doing. There's a lot of depth and scientific basis for doing all this. We need to see how we formally and informally bring it to our students and make them great physicians, great human beings. And unless we do that, I think we will not probably be happy. And when you are approaching to the centenary, I think this is one opportunity where all of us join together hands and we will do it together. I think thank you so much. And this is such a pleasure.
Now is my task to give a vote of thanks. So much has been said about uh, all the stalwarts on the dais. I don't have much to say, but even standing in the shadows of these stalwarts is a great fortune. And Pandya sir, I'm grateful to you, sir, on behalf of the whole medical humanities team for your guidance, inspiration, and tolerance of our shortcomings. Your self-discipline, soft skills, and persistent quest for knowledge are something that we all draw inspiration from, and that wisdom I also receive that, and it's something wonderful. And I really want to keep receiving that. Thank you, sir. Madam, for your guidance, encouragement, and inspiration. Thank you very much. Super, sir. Sir, there couldn't have been a superior choice for the NVLK chair. Your knowledge, team, teaching skills, and circle of influence will definitely help us grow and develop further. We thank you for accepting the responsibility and look forward to learning from you. Lopa Madam. Besides many other skills, she has one skill of being self-effacing, invisible, and still influence the course of events. You have any problem, you just call her and she will have a solution to you. She will have any number of any person in KEM or the alumni. She will have it on her phone and she will send you the number in 3 to 4 minutes. You have any problem, approach her. You want to pour your heart out, approach her. So where could I get such a person? Thank you so much, madam, for being there. Pandya madam and Ravi sir. These are the people who actually conceived the idea, planned about how MH should be formed, and the Supe sir. They are instrumental in giving birth to this chair. So thank you very much, madam. Thank you, sir. Then there is a humanities has always been student centric and work with students, and actually students have conducted our programs. So thank you, Rahul, Jason. Thank you, past secretaries. Thank you very much for being there and conducting our programs. Thank you, the whole team of medical humanities, Mudula, Santosh, Swarupa, Smriti, Varsha. Nitya madam is not there just now. I think she's busy with NABL and NAC and all that. So thank you all very much for being there. Janak Alumni Association has been our important behalf, and thank you, sir, Dr. Sir, on behalf of Vizimag Alumni Association in representing the association today. I request Natpar sir to present a bouquet to Dr. Gokti. Yes, madam. Actually, Supe sir spoke about Glycerin, madam. Again, her circle of influence and her networking has helped us a lot, and she has been there. And the soft and encouraging words that she speaks, one person to speak to really. Thank you very much, madam. I would request Sindha Kamath, madam, to felicitate her. Rama Malik madam is not there today, but she has been our constant support, and she has done every work that we required to be done, secretarial work. And beyond that also, she has known how BMC works, and she has given us so much guidance all throughout, So I would like to thank her. And Dr. Sanjay Bindra, I must mention, because he's reaching out to all the faculty, rather the alumni all over the world, and getting support for the students here and our medical humanities. Dr. Shenvi madam for coordinating all the scholarships which Gosumek Foundation is offering to our students. Dr. Kushale sir for helping us conduct our programs. Yes, that's it. I think if I have forgotten anybody, it is purely by oversight. Sachin, for the beautiful donkey outside, the emotion that Rangoli gives, even sketch or painting couldn't really give, he is always about 2% for Rangolis for us. And MLT staff, of course. And thank you all very much for sparing your time and being here today. And we conclude the event with national anthem. Thank you. नहीं फोन पे नहीं है बोलने का
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तिरंगा तब शुभ नामे जागे तब शुभ आशीष मागे गाहे तब जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय 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 हे
Jai. I request all to partake of the snacks outside.